Pain medications are also known as analgesics. This group includes narcotics, non-opioid pain medications, fever reducers, and non-steroidal anti-inflammatory drugs, also known as NSAIDs. The first group we are going to look at are the narcotics. Remember, medications in this group are controlled substances. Narcotics are also known as opioid analgesics and include opium derivatives and synthetic drugs with similar properties. They are generally used to relieve pain, but some may be used to control coughing or control diarrhea. Common medications you may see are codeine, fentanyl, Lortab, Demerol, methadone, Percocet, and Darvocet. It is very important to take the medication exactly as prescribed. Avoid taking with alcohol or other central nervous system depressants. Be careful when getting up from the bed and walking. Avoid hazardous activities until full effects of the drug are known. Increase fluids and fiber in the diet to reduce the risk of constipation. Watch for signs of respiratory or central nervous system depression, and watch for signs of dependency. Tylenol is found in many pain, cold, and flu remedies. Remember to read your narcotic drug information resource carefully. Many pain medications include Tylenol. For instance, Lortab, Percocet, and Darvocet. It is very important to be sure to double-check for Tylenol in prescription pain medication and over-the-counter remedies before administering Tylenol to the person you're caring for. Many Tylenol overdoses have occurred because people did not check and there was additional Tylenol in another drug. Remember, be sure you don't take more than the recommended dosage. Remember, many over-the-counter medications contain Tylenol. High dosage or unsupervised long-term use can cause liver damage. Excessive alcohol can increase the risk of liver damage. Be sure to contact your doctor if you need to use the medication for more than 5 days for children or 10 days for adults. Don't use for a fever over 103.1 or recurrent fever without consulting your doctor. Non-steroidal anti-inflammatory drugs are generally used to decrease inflammation, but may also be used to decrease pain and fever. They are divided into two categories: the non-select NSAIDs or Cox-1 inhibitors, which include ibuprofen, naproxen, and indomethacin, and selective NSAIDs or Cox-2 inhibitors, which include Celexa and Arcoxia. Important things to remember about Cox-1 inhibitors. Don't exceed the recommended daily dosage. Give with meals or milk to reduce the GI effects. Taking with alcohol, aspirin, or corticosteroids may increase the risk of GI effects. Wear sunblock and avoid prolonged exposure to sunlight. Report signs of bleeding to the doctor. No over-the-counter or herbal products without first consulting with the prescriber. Important things to remember about Cox-2 inhibitors. Don't exceed the recommended daily dosage. It should not be used before or after heart bypass surgery. May cause harm to the unborn baby if taken in the last trimester of pregnancy. Not approved for people under 2 years of age. May cause GI bleeding. Can increase the risk of a fatal heart attack or stroke, especially if used long-term or taken in high doses. Cox-2 inhibitors relieve pain and inflammation as effectively as Cox-1 inhibitors. The biggest difference is they may be used before and after surgery because they don't affect platelets function, and they have a longer duration of action. They also tend to have fewer GI side effects than other NSAIDs. The most common Cox-2 inhibitor is Celebrex. It is often used to treat osteoarthritis, rheumatoid arthritis, and acute pain. Things to remember include: immediately report signs of GI bleeding. bloody or coffee ground vomit, black tarry stools, blood in the urine, or unexplained weight gain or swelling. They may adversely affect the liver, report nausea, lethargy, itching, jaundice, which is yellowing of the skin or eyes, right upper quadrant tenderness, flu-like symptoms. Stop taking the medication and call the doctor immediately. Minimize alcohol consumption. Be sure the doctor is aware of all medications and herbal remedies you are taking. Inform all healthcare providers that you are taking this medication. Drug interactions to be aware of include Celebrex and other Cox-2 inhibitors reduce the antihypertensive effects of ACE inhibitors and diuretics. They can decrease lithium clearance and result in lithium toxicity. When taken with Coumadin, an increased PT level and bleeding complications can occur. Increased risk of bleeding may occur when taken with herbs, dong quai, feverfew, garlic, ginger, ginkgo, horse chestnut, and red clover. Aspirin is the most commonly used salicylate. It is used to treat pain, fever, inflammation, and to decrease the risk of strokes and heart attacks. Aspirin should be avoided with children unless the doctor specifically recommends it. It is believed that aspirin used in children with chickenpox or flu-like symptoms may put them at higher risk of developing Reye's syndrome, which is a life-threatening disorder. So remember, do not give to children unless directed to do so by a doctor. Give with milk or food to decrease GI effects. Watch for signs of bleeding. Avoid alcohol and restrict caffeine. Don't chew enteric-coated products. No over-the-counter or herbal products without first consulting the prescriber.